back to the Wet Dreamz Podcast. I'm your host, Jose Gonzalez, and I am a sex therapist and a mental health counselor. And this is...
I'm Dr. Brad Hinman. I'm also a sex therapist, ASEX certified, and I also specialize in treating men with out-of-control sexual behavior.
Yeah, welcome back. We've been talking about several different topics. If you've been listening, or if this is your first time listening, that's fine too. This podcast is for the guys that we see, the men that come in typically with out of control sexual behavior, or sometimes we'll see couples. Today's episode is kind of a couples episode, but we generally will talk to our guys mainly, but it's a couples episode. And today we're going to be talking about desire discrepancy. So if for those that haven't heard the term, what is it? What are we talking about today?
Desire discrepancy is where one sexual partner has desire for sex more than the other sexual partner does. So, for example, one person might want it every day, and then the other person wants it once a week. So that we would call that a desire discrepancy because their desire for sex is discrepant.
Definitely. So how often do you, or I mean us, how often do we do the couples that we see come in for that issue, would you say?
That's a tricky question. Like how many come in for that issue?
Yeah.
Like probably maybe 1 in 10. But how many couples have that issue? 10 in 10.
Yeah. Exactly.
At least the people that come and see us, right?
Right.
Like it is definitely a prevalent issue in relationships for the people that we see. Now, I'm not saying 100% of couples on the planet have desire discrepancy, but of the ones that seek therapy, couples therapy, often that is an issue.
Well, and it makes me also think, often we'll get couples in, they maybe specifically came in for the guy dealing with out of control sexual behavior or infidelity, for example. Stuff like that. But then often what I see is that you also have desire discrepancy within that framework, even if they have come in for, like, our guys that come in for out of control sexual behavior or whatever. Right.
But I want to point out that in my opinion, the out of control sexual behavior and the desire to have sex is not necessarily the same thing, right? Like it's like I want to be clear and say that like they're not doing out of control sexual behavior because they have a high sexual drive. Some of my clients will say that to me, and I'm like, that's another issue. So the people that come to us for out of control sexual behavior, they're probably trying to cope with something else, which really doesn't have anything to do with sex. It's they're coping with emotional trauma or whatever. And they're using sex as an addiction to cover that up, right? To kind of move away from whatever the trauma is. But anyway, that doesn't have anything to do with desire discrepancy.
Right. But that's, so what you're saying, and I'm going to emphasize this again because I think that's hot button topic, whatever, controversial. So what you're saying is often the guys that we see, if they engage in their out of control sexual behavior, which is whether pornography or, hooking up with people, talking to people online, they don't necessarily do that because they have a high desire for sex, and maybe on top of that because they aren't getting enough sex in their relationship. That's kind of what you're saying.
Correct. That is what I'm saying. Yes.
Yeah. And I emphasize that again because I think that's the misconception that, I mean, we have a study that we're doing, which needs to be continued to be done, but often the misconception is that the guy is unhappy in the relationship or not getting sex enough or whatever, or is unhappy with their partner, and then that specifically causes them to go and seek these other forms of coping or whatever. Right. That's often the misconception, right?
Right, exactly. Like we don't say like somebody with alcoholism, they're not drinking enough water. Like, you know what I mean? Like it doesn't make sense. So a person who has out of control sexual behavior is doing that for other reasons like to compensate for trauma or whatever, like I just said, they're not doing it because they're not getting enough sex, right? They're using sex as a coping mechanism, just like one would do alcohol or heroin or whatever.
Mm-hmm. Exactly. Yeah, and that's tough. I mean, that's part of the big conversation I know I have with couples, both desire, discrepancy, and specifically out of control sexual behavior. Is there's often that thought that, and it's a natural thought to have, like, what's wrong with me as the stereotypical female partner? What's wrong with me or our relationship that my partner is going and doing these things that are outside of our relationship contract or whatever.
Right.
Mm-hmm.
Yep. So, desire discrepancy.
Yeah. Yep, go for it. Bring it back.
Right.
We'll get into all of that.
That would be a great episode to talk about why people have out of control sexual behavior. But desire discrepancy, again, when one partner desires sex more often than the other partner, it's not uncommon. It's not an uncommon problem at all. And what happens when people have that issue is that we just simply do a negotiation, right? Like we talk to them about, like, what would it take for you to want to have, so we talk to the lower desire partner, what would it take for you to want to have sex more often? And so typical couples things come up, right? Well, he needs to talk to me more. He needs to pay attention to me, not just when he wants to have sex, but other times as well. Mm-hmm. He needs to stop grabbing my body when he walks through the kitchen. He needs to or walks through the garage or whatever, mm-hmm. wherever this is taking place. So things like communication, things like paying attention, like acts of service in the coupled relationship. So doing things for your partner that your partner would like. And so words of affirmation is another good one. So like affirming your partner for stuff that they do or say. And so desire discrepancy is pretty important because it drives a wedge in the couple, and then they continue to move apart. It's one more area where couples think that they're incompatible. And desire discrepancy does not make people incompatible. It's just an area where people need to talk. Mm-hmm. It surprises me. It continues to surprise me as a therapist how little couples talk about sex, about sexual desire, about what turns them on, what turns them off, their fantasies. Like, couples don't talk about those things, and they need to talk about them in order to figure out what makes your partner happy and what makes you happy. And if you keep that a secret, then you expect your partner to read your mind, and then that doesn't work out very well. Mm-hmm. So that's why desire discrepancy is an important issue to talk about, especially in therapy.
Mm-hmm. Right. I mean, and you mentioned the sexual communication, and actually we had a episode specifically talking about the sexual communication mm-hmm. stuff, like how to talk about it and how you can get more sex, essentially, for the guys in that way. But check out that podcast episode. Mm-hmm. But then my thought went to what are some things that you think that affect people's desire and their desire for sex or whatever, both partners.
Mm-hmm. And I've had a lot of men where the male has the lower desire, sexual desire as well. So it's not just women. It probably, like, if we did a survey mm-hmm. just on that, it probably would still be more women have the lower sexual desire than men. But I've had men with zero sexual desire. And so, anyway, so
yep.
What was your question? What causes it?
Yeah. What affects sexual desire in people? We have the tendency to go off script. We're just going.
And so, like, things like trust in the relationship, communication. I'm going to keep saying that word. And so, things like doing things together that both of you like to do. That's not just sex, right? But it can lead mm-hmm. to sexual desire. right? Like there's things on Facebook, on social media that talks about like it'll say female porn, like her porn that women like to look at, and it'll have a guy vacuuming the carpet, right? And so because that the idea behind that meme is that's what turns women on, is when their partner does household chores, so that they don't have to do all of them, right? Or so the guy, might cook dinner, and that might be more likely to turn their partner on, because it's taking a burden off of them, right? Off of the lower desire person.
Right. So having their needs met, or the inverse, not having their needs met, affects people's desire to have sex. That makes sense for sure.
Right. And another complaint that I've heard from women in heterosexual relationships is personal hygiene of their partner. So like things like brushing their teeth, taking a shower. And so, it's, you asked the question.
True.
So I've had women say, like, I'd want to have more sex with you if you took care of yourself better. Right. And so that makes sense to me. Right. And so, things like, ask your partner, what do they like? Not necessarily in sex, but like, what are some things that you like? And if they like, going for long walks on the beach, go for a long walk on the beach. That might not be your thing, but if that's going to lead to sex, then maybe that should be your thing.
Right. Exactly.
Right. So it's like I said a minute ago, like it's all about negotiation, right? It's about, what are you willing to do in order to get what you want, right? It's very much like a business, right? Relationship.
Right.
And so, like, I think that there's probably dozens of things that we could list off that affects one's sexual desire. There's a lot of things have to fall into place. Like if you have children, the children need to be in a place where they're not going to see you have sex, right? So, and especially, unfortunately, in this society, childcare falls a lot on the female, right? And so the male's like, okay, I'm ready to have sex, and the female's like, well, but the kids, right? What's going to happen with the kids? And so, making sure the kids are taken care of, or at least occupied, or maybe at grandma's house or something. Is going to increase sexual desire, right?
Right, and stereotypically again, but a lot of the couples we focus on, I don't know if we've probably said that. I repeat myself. I say this a lot. There's the Emily Nagoski metaphor imagery that she has about the accelerators and the brakes, and often men are more sensitive to the accelerators, which are the things that move sex along, and women are stereotypically more sensitive to the brakes, which are things that stop sex. So in that context, in that framework, as the man, stereotypically, you're trying to reduce the amount of things that is going to stop the interaction, stop the desire, stop the interaction, like kids being around, like your dirty breath, stopping. There's nothing less sexy than like smelling dirty breath. Any of those things that inhibit it, as the man is focusing on that, and then inversely as the female is, what are the things that are accelerated, like the slapping the butt thing, or wearing sexy lingerie, which is stereotypical, but it can work for some people. Again, it's the accelerators things. I think that's kind of a general framework that I often will tell my clients to think about.
Thinking about accelerators and brakes. Like things, everything you said is right on.
Thanks.
And so, it's important to also understand that, especially for men, when they want to have sex, so when they walk by and slap somebody's butt, and the person's like, stop, I'm trying to put the kids to bed or whatever, and so in marriage and family therapy, we say the person that's slapping the butt did a bid, right? They bid on sex. And so when they feel rejected for sex, they're going to feel rejected all completely as a person, right? You don't love me. You don't want to have sex with me. You don't like sex. I'm doing it wrong. It's going to lead to a lot of conclusions because, again, there's no communication, right? There was no communication like, hey, I like sex. I just not right now. I can't do it right now.
Right.
And so just even adding that I can't do it right now is going to take away some of that. Like, I feel rejected as a person. I feel like you don't love me. You're never going to want to have sex with me. You don't ever want to touch me. Right. It's so it's going to lead to a lot of conclusions that are not true necessarily. Maybe they are true and you need to have a conversation about that.
Right.
But men especially feel rejected because men get a lot of love, feeling loved through physical contact. And that includes sex, but it's not just sex. So things like kissing and hugging and holding hands and cuddling, putting your arm around each other, going for car rides and, having your hand on each other's thighs or whatever. All of that is physical touch. And so men have been trained to, over the years, at least in Midwestern American society, that really is the only way we get physical touch is through sex. And so that's why men are stereotypically, all they want is sex. Well, what they really want is physical touch.
Right.
And that's the only way to get it is through sex.
Right. And that's probably the only way often they've learned to initiate sex or to initiate touch is through that banter or the like ill-timed like touch essentially, you know what I mean? Because they weren't often I'm a man, we weren't taught the proper way or better ways to initiate that with our partners.
Right, because it's considered more manly again in Midwest American society to like grab your partner or say I want sex, rather than to say I need a hug. Right, saying I need a hug is not as manly. Right, and so that's why men ask for sex. Now I'm not saying that whenever men ask for sex they really need a hug, but it is physical touch, right? And sex is pleasurable and enjoyable and should happen. But I think there's times when if sex is refused, often what I'll tell my couples is if you don't want to have sex, then offer something else, right? So no, we're not going to have sex, but I would love to sit on the couch and watch a movie with you and we can cuddle while we're doing that, right? And so that would be better than nothing. It's not as good as sex, but it's better than nothing.
Right. And depending on your reaction as the guy receiving that feedback can potentially lead to sex. If you're like, no, that's not what I want, like then for sure it's not going to lead to sex. But if you're, in the moment, okay, honey, I can do that. I'll bring some snacks then so we can sit or something. If you're game, then it's possible that it might lead to sex as well.
Yep.
You know what I mean?
Exactly. Yeah, because it's gonna push on that accelerator, right? Being willing to sit on the couch and cuddle with snacks is going to push that accelerator down and lighten up on the brake.
Exactly. And another thing that popped into my mind surrounding this whole conversation is also the medical issues can be another thing that gets in the way of sex and desire as well. That's often couples that I've seen, there may be a medical thing going on, whether that's a pelvic floor issue, women's types of issues, painful sex, whatever, those kind of things. There's another factor, another layer of the conversation, I think, for sure.
Yeah, there's and it just simply takes longer for women to get ready for sex than it does for men to get ready for sex. And so, like, I'll joke it's a joke, but it's kind of serious. Like, I'll joke with my guys and say, if you want to have sex at 10 o'clock at night, you need to start at 10 o'clock in the morning. And so it takes longer than just a grab as you're walking by somebody, right? You should really like say nice things and tell the person what you appreciate about them and all these kinds of stuff. And then that's going to be more likely to lead to sex rather than no communication all day long, or worse yet, fighting all day long. Mm-hmm. And then 10 o'clock at night, you're like, oh, we're going to have sex now, right? No.
Mm-hmm. Right. Exactly. So I think specifically for our guys, because our guys are the ones, I think it's about their response. Take that situation, you haven't talked to them, but then throw on, like I said, like a medical issue or something. Like throughout that time, is your response really makes a difference, I think, as a guy specifically. If you're pouty, if you're like, then that pisses you off or whatever, mm-hmm. that's not going to lead to sex, but if you're open and even open to the process that sex isn't just intercourse, like intimacy and touch can be other things other than intercourse, especially if your partner has pain during penetration. But if you're open to that, I think that's the name of the game. I feel mm-hmm. like for our guys, it's like being open and your response being kind, I guess. That's the best way I could put it. But
mm-hmm. Yeah, it can. And I've had female clients with painful intercourse. And that has, with some of my clients, that has lessened with appropriate like sexual communication and interchange before actual sex needs to occur, right? Mm-hmm. So we call that foreplay, right? Mm-hmm. So yes, foreplay can actually be talking, right?
Right, exactly.
And vacuuming the carpet and stuff like that, right? And so sex can be less painful with some of these other activities that we're talking about surrounding sex, kind of peripheral to sex. If the guy engages in that, then their partner may be more willing and more able to actually have sex with them. Mm-hmm. So some of these medical issues can subside, and even erectile dysfunction, right? Issues,
right?
And so premature ejaculation, delayed ejaculation, not being able to maintain an erection. Mm-hmm. Once an erection occurs, or not being able to get an erection altogether, right? So there's multiple different mm-hmm. kinds of erectile dysfunctions in men, and that can also be. I've seen some of those symptoms be alleviated through more sexual communication, more talking about what you like and what you don't like, and just kind of being in a trusting kind of close relationship with your partner. Then some of these other issues can abate. Now, I'm not saying if you have a conversation with your partner, all your erectile dysfunction right. is going to disappear, but I have seen it help. Right. So I'm not saying it's a universal mm-hmm. magic wand mm-hmm. that's going to make all problems disappear, but I've seen it help.
Mm-hmm. Right. Well, and it's that, again, that openness and that willingness to be vulnerable, both with your partner and, with a medical provider or whatever. The whole, especially with erectile dysfunction, often is getting in your own head kind of deal that I've seen some of the clients that I've had. It's been, you're in the moment, and then like, oh, freak out, or perhaps I've had several clients with ADHD that they just can't focus as much. Mm-hmm. But, again, I think being open to communication or being vulnerable with your partner, like, hey, this is going on right now, like I'm kind of losing focus, like, okay, then we'll stop and we'll try something else, or mm-hmm. we'll take a break or something, you know what I mean? It's counteracting those feelings. I almost want to say shame, but probably shame for some people, but those negative feelings that is going on is being open, being vulnerable.
Yeah, we're vulnerable is a really mm-hmm. that's a good word to talk about, because men don't like to be vulnerable. Mm-hmm. Men don't want to be in a position where they are vulnerable. They don't want to say that they're being vulnerable, because again, that's not manly, right? And so, but there's a whole lot of women that don't want to be vulnerable as well. But you're asking someone to be penetrated. That's super vulnerable, mm-hmm. but you don't want to be vulnerable either, right? So you don't want to be vulnerable right. enough to say that you're to ask for what you want because that's too vulnerable, but you're asking your partner to be penetrated.
Right.
That's super vulnerable, right? So in order to get what you want, you kind of have to.
Yep, that's also a theme of today's episode as well. In order to get what you want, you have to do some things.
You have to do some things and give up some things, right? You have to compromise.
Well,
yeah, but it's. I mean, if sex is the goal, it's worth it in the end, right? So,
so for sure. So another thought that comes to mind, another question, because I think we deal with a lot of religious couples in the area that we are, Midwest Michigan, Southwest Michigan. How does this all play, and also what's the interplay between desire discrepancy and just sexual desire in general, and then religious relationships or couples that we see? Like, how does that interplay, make it more complicated, make it better, whatever, What are your thoughts about that?
It's a big question.
Yeah.
But I think in some very traditional religious couples where there's this element of the female needs to submit, right? And there's a lot of very loose interpretation in the by people about what the Bible means when it says that. Some people interpret that to mean you have to have sex with me when I tell you that you have to have sex with me, right? Very unsexy.
Exactly.
Right? That is not conducive to the female being able to be penetrated, right?
Right.
And so we're talking lack of lubrication, lack of relaxed muscles that need to happen in order to be penetrated. And so it's not sexy time to be told that you have to be penetrated because God told you to do that. And so there definitely, then you can see that's going to lead to more desire discrepancy, right? Because if I'm telling you have to submit to me, then that means the next time I want to have sex, you're not going to want to do that because you know that I'm going to assert that authority over you, right? So that can be very dicey as far as desire discrepancy goes, right? It can be you're really sabotaging yourself that way. I'm talking to the males, right? You're really going to sacrifice. You're going to really be. That's detrimental to what you want to have happen, because most men want their partner to want to have sex with them. They don't want to force their partner to have sex with them.
Right.
And so, and I'm not saying you're interpreting the Bible correctly or not. I'm just talking about desire discrepancy. Right. So commanding someone or guilting them or shaming them into submitting to you is not going to make them want to desire sex with you. So now you're increasing the desire discrepancy.
Right.
And probably people do that because they're trying to force the person with lower desire to have more desire, but really it's going to work the opposite.
Right.
They're going to have less desire because you're forcing them. So wouldn't you rather talk about it and work out a negotiation, a compromise, and figure out what your partner wants to have done so that they want to have sex.
Right.
If that's making sense.
Yeah, I mean, I'm always so surprised by that. Like, that concept is everywhere. I think about it with my kids, but the more you force somebody to do something, like, can we not just agree that never works out? Like, it has the opposite desired effect, the same as like not forcing your kid to not date someone. What they're gonna do, they're gonna find ways to date that person, have sex with that person, whatever. Like, can we just agree that being that forceful with things never works out? But we continue to do it. We continue to try to force people. Like that's gonna have any effect on someone's internal, subjective, sexual desire? You telling them to change it when they probably feel bad about it anyways, and they want to change it themselves. But you're thinking that forcing that on someone is gonna increase that sexual desire. It just doesn't make sense to me.
Yep, it's going to make it worse.
Humans
have a knack for doing things that make our problems worse. Or worse yet, we do things to make the opposite happen of what we want.
Right.
What we're most afraid of, that's what we're going to make happen. Humans have this. We're gifted in that area.
Right. Definitely gifted. The other thing that comes to mind too is we talked about the sexual with regards to this conversation about religion. Which, side note, we have another episode previous talking about religious shame. So check that one out. I think it's episode 2. Anyways, but another part of this conversation, like we've talked about the sexual communication. So then it makes me think of this idea we talked about in that episode. This idea that as religious people, or at least specifically with Seventh-day Adventists, because that's what we grew up with. There's this idea that premarital sex is bad, so it's shameful. You're not supposed to do anything regarding premarital sex or any other type of sex, which of course it happens. And then all of a sudden you're supposed to flip that switch in marriage and be like, okay, now we can have sex all the time and be fruitful and multiply. So I think there's, on top of just not talking about sex as a religion in the couple, then there's not much sexual communication. Definitely not before marriage, because you're not supposed to be having sex. You're not supposed to be talking about what you like sexually. What do you mean? And then all of a sudden that's supposed to change, and it doesn't, because then the lack of communication stays consistent after marriage. So they're not talking about what they like or what they enjoy, because there's still this shame wrapped around sex. So yeah, again, that's another thing that widens that desire discrepancy, because you're not even talking about what you like,
Right. Yeah. I completely agree with that we're raised in a society where we don't talk about sex. We don't have sexual discussions. If families do have sexual discussions, it's don't do it. Right? Don't have sex. That's the extent of their sexual discussions. And so, but like you said, then when we get married, now all of a sudden we're supposed to be sex experts, especially the men. Right? We're supposed to be experts at having sex when never having done it and never having talked about it.
Right.
So somehow it's just supposed to like, boom, be present, downloaded into our brains on our wedding night.
Immaculate conception.
Yeah, that's right. Exactly. And so I just think that we, especially as couples, if your parents are going to talk to you about it, then as a couple, you need to talk about sex, talk about frequency of sex, talk about desiring sex. What makes you desire sex? What makes you want to have sex when you didn't want to have sex 10 minutes ago? Right? Have those conversations and make note of it in your brain or on your phone of those things, because it's not. Men and women are acculturated differently around emotions and sex and feelings and shame, all those things, everything. Men and women are acculturated differently. And so it's not going to be natural. It's not, there is going to be a discrepancy there around all those things. And so if we communicate about them, then it's going to be a more solid relationship. It's going to be a more solid sexual relationship. And both people have the potential to be happy. I tell my couples often, I don't want you to have sex if you don't want to have sex. Right? I am not, because that's what the person with lower discrepancy, a couple with desire discrepancy, the person with a lower sex drive, they fear that when they come to therapy, the therapist is going to say, have more sex.
Yeah.
And I'm like, I don't ever want you to have sex unless you want to have sex. But my goal is to get you to want to have sex more often. And then the person with the higher sex drive is like, yes.
Exactly.
And so you just teach them how to get their lower desire partner to want to have sex more. And there's lots of ways to do that.
Yep.
So
what's your, this is off script, but a question that came to mind, because I think I hear this from a lot of couples. What's your opinion about scheduled sex and also kind of forcing yourself, quote unquote, forcing yourself? I mean, you just kind of said your opinion, but pushing yourself to have sex. What's your opinion about that?
if okay, so in a given moment, right? If my partner says I want to have sex and I don't want to have sex, no forcing. Because to me that's sexual assault or rape, right? And so I'm opposed to that. But if you're saying, if I generally don't want to have sex, should I try to get myself into a place where I want to have sex more? I'm in favor of that. But if you're talking about, okay, it's 10 o'clock and we're going to bed, you're going to have sex now.
Right.
No.
Hard no.
Hard pass, yes. So, but if you're saying, should the lower desire person bring themselves to a place where they want to have more sex? Yes, I'm all for that. And I can help people with that, right? I can help people want to have sex more, right? And so that's our job.
Right.
And so, but there's a difference between those two things, right? There's another part of your question.
Scheduling.
Thank you.
Yep, I got you.
I wanted to address that too. Like scheduling sex, I'm all for that. I have no problem with that. I've done that with clients before, right? I have a couple that I'm working with now where they both want to have sex. It just never happens. They have a small child. And I can just hear people's heads nodding as I say small child. Right? Like whoever's listening to this, I can hear your head nodding. And so like sex just doesn't happen. And so I'm like, you need to schedule sex, like have a meeting on Sunday and figure out what day that week you're going to have sex. Right? So grandma needs to take the child. In this case, grandma often, and so like figure out a day. You don't have to tell the babysitter what you're going to do. Or you can I don't care.
So we can have sex.
Right? But I told them, you need to schedule a day to have sex. And they've started doing that, and it's actually helping. Yeah. Right? So, but again, like I said way earlier, the child, right? That with the child out of the picture, so that they don't have to worry about the child. That makes a big difference for them, because otherwise they're both busy and they both kind of carry on with their lives, and then it's been 2, 3, 4 weeks before since the last time they've had sex. The biggest complaint I get with couples of scheduling sex is they're like, well, that takes the romantics out of
it's not sexy.
The romance out of it. It's not sexy. I want it to be spontaneous. Okay, but your spontaneous led to not having sex for a month. So you tried it your way. Now you're going to try it my way.
It's true. I mean, and I think I had mentioned that, again, I'm talking about past episodes, but I think we talked about that. But, like you're contending with having, what they call a spontaneous desire. You're contending with having the right time to do something. Then both partners having spontaneous desire, and they're both ready to go, ready to have sex, and the conditions in your house or where you are desirable, where there's no kids, where you're not worried about money that day, where whatever, like that, those 4 things having to be in place. Like, why are you making it more difficult? Like, what's the probability of all those things being perfectly aligned every time? You know what I mean? So you have to do something.
Right. Right. But that reminded me too, like don't just say, okay, we're going to have sex Wednesday night and then ignore your partner between Sunday and Wednesday, right? You need to be working on that relationship. You need to be working on doing things to make your partner want to desire you, right? You can't just like be, I'll see you Wednesday, right? And like live separate lives between Sunday and Wednesday. You have to, be excited about that and communicate about it. And I can't wait for Wednesday. I'm so excited. And what can I do to make this easier for you? What can I do to make you happier? Whatever. So do relationship-y things between whenever I'm saying Sunday, because that's what my client did.
Right.
What can you do that fosters a good relationship, a close relationship between Sunday and Wednesday, so that Wednesday you both want to have sex. So some of these things are in line. Then,
right. Giving yourself the best opportunity. Definitely.
For both of you to be ready.
Yep, for sure. Yeah, I mean, I definitely get that. I get that that criticism from scheduling sex, like, oh, it's not romantic, not sexy. But I think you put it perfectly. Like, your spontaneity caused you not to have sex for a month, or in some cases a year or whatever. For our clients, like, let's switch it up, and maybe that'll help. Like you said, you've tried it your way.
Yeah.
I love that.
Or schedule one sexual interchange.
Yeah.
And then have one be spontaneous. I'm fine with that too.
Mm-hmm.
Right.
Right. Yep.
But again, like, couples will go days or weeks without having sex, and I'm like, well, we need to reintroduce this back into the relationship on a regular basis.
Mm-hmm.
Right.
Mm-hmm. Definitely. Awesome. Yeah, I mean, that leads us then, I think that one, the scheduling sex, is a big strategy that can be used. But, what would you say as kind of a wrap up, as a strategy or a takeaway from today's episode that, specifically I'll focus to our guys, because that's what we're here for. But what would you say other than those is maybe a takeaway / tip that our guys can take after this episode?
I think for me, like, just getting our listeners to hear that it's not necessarily that guys want sex all the time. It's guys want physical touch. They want affirmation. They want to be valued. They want to be nurtured and cared for, and all those kinds of things like that, which we can get through sex. Right? Sex is one way to get those things. So it's not necessarily that guys want sex all the time. And then there's guys out there being like, yeah, I do.
I do. What are you saying?
But you do, because that's the way you get love, right? So it's really love. It's love that we want all the time. Right? And we can get that through sex. Right? So sex is a means to the goal.
Yep.
Right? And you can argue with me if you want, but research bears that out, right? That it's really physical touch, it's words of affirmation, it's feeling close, feeling emotionally bonded to our partner, but you get all that through sex, but you can also get it through other ways.
Exactly. And with that, I think perfectly then goes to my point is being open to those other experiences. I think the big thing that I would have our listeners, our guys, try to be aware of is other experiences other than strictly penetration that can get you what you want or what you need in that time period or whatever. It doesn't have to be just penetrative sex to get you to feel close to your partner, to get you to feel loved, to get you to feel affirmed, to get you to feel confident, to get whatever the feeling is there, is being open to other experiences, cuddling, just the foreplay and no penetration, whatever. Like, I think we need to open up our frame of reference, open up our lens to be open to those other experiences for sure.
Yeah.
Awesome. Well, that felt like it flew by, but and I'm sure that could bear another episode, part 2, but we'll get there when we get there. Yeah. Thanks for listening to our podcast, and obviously if you have any questions or any thoughts or whatever, feel free to check out our social media. We have a Facebook page, a YouTube video accompanying the podcast. And like and follow all that stuff that the people online say.
Yes.
Thanks for joining us.
Thanks.
Here's just a tip. Here are some tips to combat desire discrepancy. That is, when partners have differing levels of sexual desire. 1. Open communication about what you desire sexually. The first step in combating desire discrepancy is actually knowing details about what turns your partner on. 2. Compromise in scheduling intimacy. I know, scheduling may not seem like the sexiest thing in the world, but would you rather have scheduled sex or no sex at all? 3. Change the context. The environment around us has a lot to do with how desirous we feel. Changing our environment can make all the difference. 4. Explore non-sexual intimacy. When we feel closer to our partners in ways other than sex, that can lead to more openness to being physically intimate. The Wet Dreamz Podcast and any content posted is intended for general information, educational, and entertainment purposes only. We are not responsible for any losses, damages, or liabilities that may arise from the use of this podcast. It is not intended as a substitute for the advice of a physician, professional coach, psychotherapist, or other qualified professional, diagnosis, or treatment. Listeners should not disregard or delay in obtaining a medical advice for any medical or mental health condition they may have, and should seek the assistance of their healthcare professionals for any such conditions.